Welcome to Sunstar Gum's virtual training on interdental cleaning to prevent and treat gum disease, where we review the state of the evidence and work out what it means for you. You're about to discover Module 2, in which we explore the latest literature on different interdental cleaning methods and how they contribute to prevention in periodontally healthy subjects. Module 2 is part of a series of 4 training modules based on the evidence from 17 randomized controlled trials and 6 systematic reviews and meta-analyses. One expert will guide you, Filippo Graziani, professor of periodontology at the University of Pisa and past president of the EFP, the European Federation of Periodontology. Module 2 on prevention was developed to expose you to the latest peer-reviewed literature and take a deep dive into one RCT comparing floss, interdental brushes, and rubber interdental cleaners. To allow you to evaluate outcomes based on key clinical parameters relevant for periodontally healthy subjects. To support your patient conversations on the best interdental cleaning approach for each of them. To allow you to benefit from expert faculty commentary. What's your take? For young periodontally healthy adults, is interdental cleaning optional? Will any interdental cleaning device do the job? 2 randomized controlled studies by Graziani and by Bourgeois at the University of Lyon, France, found that in adults under the age of 30, interdental cleaning already has a significant impact in reducing plaque formation and gingival inflammation. Let's take a look at the evidence. We reviewed evidence from RCTs, systematic reviews, and meta-analyses for commonly available interdental cleaning devices: floss, interdental brushes, and rubber interdental cleaners. We started with a simple search strategy in PubMed, using the search term interdental and the relevant type of trial. We then selected papers that compared the efficacy of different interdental cleaning techniques in controlling plaque for the prevention of gum disease in periodontally healthy subjects. We identified 3 prevention studies in 141 periodontally healthy patients with a study duration between 4 weeks and 3 months, and 6 systematic reviews and meta-analyses. The literature search indicates that some interdental tools are more effective than others. The reported outcomes were interdental plaque and gum inflammation. Because if these become apparent, it means that gingivitis is developing. The studies showed that in young periodontally healthy subjects, the efficacy of rubber interdental cleaners was comparable to gold standard interdental brushes. Both significantly reduced interdental plaque after a single use, and bleeding after 4 weeks compared with baseline, with no significant differences between the cleaners. What about compared to floss? In young periodontally healthy subjects, both rubber interdental cleaners and interdental brushes were more effective than floss, leading to significantly lower levels of interdental plaque and gum inflammation. The benefits were evident as early as 1 to 2 weeks. Thanks to the randomized controlled nature of multiple studies with similar outcomes, we can safely say that these results were not due to chance, but to an actual effect of the treatment. Let's dig a bit deeper and compare these interdental tools across specific interventions. We looked at 2 studies, Graziani and Bourgeois, and 2 systematic reviews, a 2013 Cochrane review by Poklapovich and Worthington, and a 2018 meta-analysis of interproximal oral hygiene methods by Kotsakis, published in the Journal of Periodontology. The key clinical parameters are once more interdental plaque, gum bleeding, and gum inflammation. All the evidence indicates that interdental brushes are effective versus baseline for all outcomes: interdental plaque, gum bleeding, and gum inflammation. They are also more effective versus toothbrush alone and versus floss. What about the evidence for the latest generation rubber interdental cleaners? In his study, Professor Graziani looked at two clinical parameters, interdental plaque and gum inflammation. He found that rubber interdental cleaners were more effective in reducing dental plaque versus baseline, toothbrush alone, and floss. They were also more effective in reducing gum inflammation versus baseline and floss. So what is the best way of reducing interdental plaque in adults with healthy gums? Let's take a deep dive into a recent randomized controlled study published in the International Journal of Dental Hygiene by Professor Graziani and his team in Pisa. The study compared 4 different oral hygiene regimens in healthy young adults with intact papilla. This was a single-center study with 1-month follow-up. Following screening for inclusion and exclusion criteria, patients were randomly assigned to one of 4 groups: toothbrush, toothbrush plus floss, toothbrush plus interdental brushes, or toothbrush plus rubber interdental cleaners. At time point T-7, 7 days prior to study start and subsequent to screening and baseline randomization, patients received careful oral hygiene instructions. At time point T0, patients received professional supragingival scaling and polishing. Outcomes were recorded 4 times over the course of the study, at baseline and then at 3 other time points up to 28 days out from study start. As the schematic shows, the study included an unclean and a clean phase, namely before and after professional scaling and polishing at time point T0, respectively. At 28 days, both interdental brushes and rubber interdental cleaners showed superior efficacy to floss on interdental full mouth bleeding scores. Rubber interdental cleaners were associated with a significantly reduced score when compared to floss. Interdental full mouth plaque scores showed significant differences in Group 4 and Group 3 versus Group 1 and Group 2. As Professor Graziani commented in the paper discussion, interdental brushes seem to be the primary choice, as it's not only a matter of efficacy, but also of effectiveness. Interdental brushes are easier to use than floss, showing higher compliance than with floss. Let's hear the expert. Which study has had the most impact on your understanding of oral hygiene?
All my profession can be summarized most probably in 70, 80 papers. And out of these 70, 80, I don't know, out of this bunch of study, surely one of the first is the Axelsson and Linden 1981, which is what I believe it is really the base of modern oral hygiene. In that study, what they did, these very famous Swedish researchers, of course, was to take a huge sample of patients, we're talking about 400 versus 200, and trying to analyze a sort of a real-life questions. What is the difference of people that is just going to attend the dentist once a year to be cleaned over the year, over 6 years in terms of both gingival inflammation and caries, versus a population that is seen every 3-4 months, motivated continuously, and once again followed up to 6 years. I think the main findings can be summarized very, very briefly, but they're crucial. First of all, population per se, I'm talking about population, of course it's not a population sample, but it still is a huge one, can brush better with a toothbrush, but they cannot really clean in between their teeth unless somebody's been with them to try to motivate and help them how to do it. First point. Second point, even if they brush better the teeth in terms of the occlusal bit, the buccal and the lingual, and even if the buccal plaque and the lingual plaque is decreasing, if the interdental plaque is still the same, gingival inflammation will rocket over 6 years. And this is crucial because what they showed was, they really showed that the modulator, the parameter that really changes the oral health is what is staying in between teeth. in their data is so strong that it looks like that is kind of, I wouldn't say irrelevant, but what is crucial is what you do when you clean in between. In fact, in the control group, where people was actually motivated all the time to use something interdentally, I'm not going to go in the tool. I think the concept is important. The people that were motivated consistently were capable to keep interdental plaque low, therefore they had no gingival inflammation, and over 6 years they didn't develop any caries.
How important is interdental cleaning?
It's cleaning in between that make the changes. And that is the base, for example, of all my clinical practice. Even if I have to do an implant or a sinus augmentation, my patients have to be clean, otherwise my treatment won't be so successful, irrespective of my capability. And if they have to be clean, all my team focuses on making sure that they clean correctly in between teeth. That's the first step. That's the basis.
Can you help us understand your study on interdental plaque reduction in young periodontally healthy subjects?
These people were actually following a path of nearly just above a month. And the way I designed the trial was to have two different phases, what I call unclean phase and the clean phase. Because I wanted to assess, once again, I'm always concerned about real life questions. And I think that's what a clinical researcher should do. Try to give answers to the clinician in real life. So I wanted to see the efficacy of the devices when people wasn't clean. So what happens if I go to a mall and I buy myself a floss or a pick or whatsoever, and nobody has cleaned my teeth yet. So we ran an unclean phase where actually people was briefly instructed how to use it, but without doing any supragingival cleaning. Then after 1 week, all these probants were cleaned again, and then we would have explained better the usage of our devices and then followed up to 1 month. And I think the important results that came in a population with non-periodontally affected subjects was that interdental brushes and interdental rubber pick were the one that removed at the highest level of plaque. Bear in mind that the increase of plaque and decrease of inflammation was noted in all 4 groups. And I think that's the main point. With correct instruction, any device is effective. But when it comes to understand the granularity of the difference among groups, it was very clear that in fact, the interdental devices were actually more effective in terms of plaque control. There is also a very peculiar finding that we realized that we had. The group that actually used interdental rubber pick had inferior bleeding than the ones that actually were passing the floss, but the plaque wasn't better. Now, of course, my data doesn't really allow to understand, because I didn't run the trial for that, so I can just enter the realm of speculation here. But what I believe it might have happened, that it is effective in terms of plaque, but the fact that you have a higher additional effect on the bleeding could be the fact that there is a sort of maybe of a massage on the papilla, that in this case, once again, is a fully composed papilla, because we are talking about periodontally healthy subjects once again. So there might be an effect, most probably, of squeezing, massaging, or something in a way it would decrease the inflammation.
Were the study results unexpected? Why or why not?
Studies show that basically improving plaque control, irrespective of the device, determines an improvement of gingival inflammation. But what we did, we actually stratified also the results, just taking on board the amount of plaque and the amount of the bleeding only in the interdental areas. So we made a specific focus. We played in a way with the numbers just to isolate this data. And in that regard, we saw that some devices were actually reducing even more gingival interdental bleeding, and those were interdental brushes and especially interdental rubber pick, which was actually a surprise.
What are the everyday implications of your study?
Well, I think the message is very clear. First of all, help your patients to brush properly and to do the right thing. Secondly, address properly what is needed. So I would say that interdental brushes are really one of the best options, rubber pick as well. Floss is also extremely good, but it's very difficult, so you need to make sure that you're working on compliance. And at the same amount of plaque, there is something that might work better in terms of inflammation, which is at the end of the game what you really care.
In summary, the evidence indicates that interdental brushes and rubber interdental cleaners are more effective than floss at removing plaque. They also cause less gingival bleeding and are better at preventing gum disease. The implications for dental practice? Interdental cleaning should be part of everyone's oral care routine. Interdental space permitting, recommend the use of rubber interdental cleaners, alone or in combination with interdental brushes, to all of your periodontally healthy patients. Join us for Module 3 to learn all about the role of interdental cleaning devices in the treatment of patients with periodontal disease. If you found this interesting and would like to take a deeper dive into the literature, head to the Sunstar Gum website to download the white paper and a full set of slides.